for reading this. In 1993, I was sick. I was also in great physical shape, therefore I had a problem getting doctors to believe that I was sick. Our small business had American Family Insurance. We were paying $800 a month for it. They refused to pay for any doctor's visits that did not draw my blood or pierce me. As outrageous as that sounds, try explaining that to a doctor when you're desperately looking for help, that you need to be pierced in order for the insurance company to pay for it. Those that didn't shut the door in my face told me that I was an emotional woman, thereby giving myself ulcers or whatever. So I went from doctor to doctor for a year and a half, paying $200 a visit, not including deductibles, and the remaining amounts after the insurance company did pay whatever. Scans that did not pierce me were paid for by us out of pocket, as were a ton of other tests. Finally, out of desperation, we went to a doctor in Denver. He looked at the scans and said I needed another. Back to the Colorado doctor that I had seen the most, who had ordered the original scan and saw something in my pancreas that he blew off as nothing. The new scan showed more in my pancreas and I was becoming very anemic fast. Surgery in December of 1994 revealed stage 4 cancer. After a hearty handshake goodbye from my doctor, I was given to an oncologist. A neighbor of our store had a wife who simultaneously developed breast cancer. He was also our insurance agent. At that time, either by pity or by shame, he rolled us into a better policy. I did recover, but as anyone who has experienced a major health issue with standard health insurance, the expenses never end. The follow-ups and tests continued to drain our resources. Problems developed again that were attributed to the surgery and or chemo, again the bounce between doctors and tests and scans, etc. Our savings were drained as were kids' college funds, etc. My husband left our store for a federal job with better insurance. I was spiraling downwards physically again and was no longer able to work the store. After 27 years, we closed it. I was finally diagnosed after over a year of tests and misdiagnosis and emergency room visits, many of which we had to pay for out of pocket again because it wasn't a doctor on our PPO on duty at that time. And when I asked the insurance company what was I supposed to do, they said go to another emergency room until you find a doctor on your PPO. I lost 35 pounds of water weight overnight, one night in the hospital. The rest steadily came off that I had gained. Again, I bounced back and our financial situation improved too. Again, I developed problems due to the chemo and etc. and the surgery. Again, the money was flowing out. Finally, after a minor surgery, I proceeded to gain a lot of weight. I bounced from doctor to doctor again looking for an answer, back to Denver, where a doctor saved me. It was revealed what had caused all the problems, including probably the cancer. After 4 days last New Year's at University Hospital, I came home feeling great. I told my doctor that I wanted to start treatment to try and cure the issue. When I took my prescriptions to Walgreens, I was told it would cost $730 a month. I literally sat and debated if I could put my husband and family through all of this again. I couldn't stand the thought of what this would do to us. I didn't know if I could ask him or me. It wasn't just the $730 a month. Sorry. It was the deductibles and partial pays, etc. Fortunately, after 3 days of this worrying, I was able to get the prescriptions through our insurance company's mail order, Medco, for just $65 a month. What a huge difference, yet we still have all our partial pays and deductibles, but not the $732. What if we hadn't had Blue Cross? What about all the people who don't have access to the mail order? Just the other day I was told I had to sign a paper for a test that I needed that I was told the insurance company probably wouldn't pay for, so we had to pay yet another $1,000 for it. What I thought would be a one-time brush with the god-awful insurance industry has become a lifetime partnership of angst and financial woe. This can't be what we Americans want for each other, for our loved ones, or for our children. If you or someone you care about has not had something similar happen to you, it will. Don't wait for it. Protect your loved ones. We have got to pass President Obama's public option health care reform now. Thank you.